hello, everyone. Thank you all for joining us today. Today, our discussion is going to be about issues surrounding male suicide. When we're looking at males versus females in comparison to suicide rates, men are 3 to 4 times more likely to die from suicide as compared to their female counterparts. This is a very important topic and sensitive subject. And so if you or anyone that you know are having thoughts of suicide, please contact the suicide hotline number. That number is 800-273-TALK, 800-273-8255. You're definitely not alone in this journey, and we are here to help if we can provide that support. My name is Jessica King. I'm one of the clinical supervisors here at Casa de la Familia. Today, I am joined by Dr. Saimir Thano from UCI Counseling Center and Diego Valencia, a therapist with us at Casa de la Familia. So I figured we could start off the discussion maybe with you guys introducing yourselves and talking a little bit about your journey in this world of therapy. So Dr. Thano, if you would like to start us off, please feel free.
Yeah, thank you, Jessica. Thank you for having me here and having us here. And this is definitely a really important topic, and I appreciate us making the time to have a discussion around it. Again, my name is Dr. Saimir Thano. I'm one of the clinical senior staff psychologists here at University of California, Irvine. I also run a private practice called Core Psychological Services. In terms of my journey into this field, it just came out of nowhere, honestly. I come from a culture where mental health services and mental health in general is not a priority. People don't talk about it. There's a lot of stigma and shame around it. So I never really thought that I would even get into this field. But I think through my experiences and me wanting to understand my own experiences and recognizing the importance around mental health and people around me that sort of provided me a space where I can sort of explore this opportunity to become a psychologist, I just fell into it in some ways. And I am excited and happy to be in this field and be able to support people around the world and around us. So yeah, happy to be here.
Awesome. Yeah, definitely. Thank you for your time. Diego, please feel free to introduce yourself.
It's a pleasure being here. Diego Valencia from Casa de la Familia, therapist. Have about on and off approximately a good 20 years of experience in the field, from counseling to psychiatric hospitals to ABA work to being a social worker back in the days. And like Dr. Thano said, it's as a male and Hispanic upbringing, it's definitely a taboo to seek services, to talk to someone that has nothing to do with your family and an outsider, and sharing your experiences and feelings, especially. So I completely understand where he's coming from, and I think that's one of the main things that us men encounter in our lives. Why are you going to talk to someone that has nothing to do with your family and doesn't understand you and doesn't know what you're about? That's kind of where it all commences, where it all starts. And I think it's our job as professionals to kind of change that and educate our society on the importance of seeking that service, seeking that help, and seeking that outside perspective and extra pair of eyes to experiencing different ways of managing life, the stressful moments in life. And I think it's important. So I'm happy to see another mate in the field that kind of shares the perspective and the experiences that I've also had. So it's a pleasure being here in this platform with you guys.
Awesome. Yeah, I definitely thank the both of you for taking the time to have this discussion. So I kind of want to jump right in, and we've been talking about, just in your brief intros, communities in which mental health is not a regular discussion, right? That's not something that we talk about at the family dinner table every single night. In addition to, it's not a conversation that's usually coming from the men in the family. So how would you encourage someone who's watching this video to start that conversation and open up to friends and family about thoughts about suicide, and if they are aware that someone in their close, intimate circle, if they're having the thoughts? How would you want someone to start that conversation?
Yeah, such a great question. It's we can be here for hours just talking about that particular question.
Very true.
I think as Diego also mentioned, originally I was born and raised in Albania. Mental health is not something that we talk about. Emotions, feelings are not something that we discuss or explore. Very often, struggling, emotionally struggling with things that happen in your life is seen as a sign of weakness. So as men, we are often taught not to bring that up, because you will be seen as weak. And we sort of hold on to that information and sort of work through it within ourselves. And sometimes we don't. We just sort of bury it and think that it's gone and it's no longer there. And that's one of the issues that men struggle with when it comes to suicide, because there is no space for us to bring that topic up, right? Again, even if you're having those thoughts of suicide, very often we perceive that we will be seen as weak if we were to, as not man enough, as not strong enough, that there's something is wrong with you, there's something is broken. So it starts with recognizing that those are normalizing and recognizing that type of topic is normal. And even asking that question, just direct question, if you're noticing something that is shifting in your partner, in your brother, in your cousin, in your friend that identifies as male, asking that question directly. Hey, I'm worried about you.
Yes.
Are you having such thoughts? Are you having thoughts of wanting to harm yourself? Are you having thoughts of wanting to end your life? Even being direct, it's such a great way of approaching it, because very often it will normalize that what they are feeling, it's okay. What they're feeling is normal, and there's nothing to be judged about. So even as simple as that can go very, very far.
Awesome.
Completely agree. Couldn't agree more. I was actually making a list as you were talking about things that just kind of pop in my head, and I think as families, it's our duty as family members, it's our duty to start recognizing different signs that, especially the men, because we tend to be a little more sheltered in that sense, something that we don't discuss, close-minded, if you will. And the minute that one of your family members or significant others even begins to manifest these different behaviors, I think as family members, it's our job to recognize those things and have a conversation. How are you feeling that? And start exploring the different behaviors that they're starting to manifest. And yes, it's super important. And I think it's not as a therapist or as a professional, but as a human being, to begin to explore that with our friends, our families, our partners. And I think it's important for us to discuss it, open up that discussion, that channel of discussion and of communication that sometimes can lead somewhere, not necessarily directly, but indirectly at times, and begin to recognize the different signs that the people in our lives are starting to show.
Awesome. You both actually touched on some of the signs. Maybe if you can share, again, for the viewers that maybe have never had this conversation, what are some of the signs that they can look for?
If I can add something to what Diego mentioned, just briefly,
Sure.
What can be very helpful too, as well, is even you as an individual already having those conversations with that other person, just saying, hey, I'm struggling. I'm having a difficult time with what's happening right now. I'm sad, I'm depressed, I'm anxious. Right? Even that in itself can normalize and help the other person feel more comfortable and be more open to them. Like, oh, you are feeling this way. I'm having those same feelings, versus very often we do feel alone and isolated, especially men in these experiences. And then, if you were to come in and say, like, I'm also having those same experiences, they are going to be more likely to share what's happening for them as well, because you are inviting that, creating a space that is welcoming and affirming of those experiences, right? So going back to your question, Jessica, which is another great question, there is different signs that we can look out for. And it doesn't mean that those signs are equal to someone wanting to end their lives either. So we have to be mindful and careful, but are definitely helpful in guiding us in what to do moving forward. It can be, as sometimes people talk about, I don't want to live anymore, or this is too hard, or maybe what's the point? So there can be verbal statements like that. Or even when some of us may make statements, I was like, I just want to kill myself, right? Sometimes it's done in sort of a comical way, maybe joking, but sometimes it's serious. So we we can't take it lightly and really follow up with those statements and check in with them. What does that mean for them? Right? What does that look like? What's the message they're trying to convey to us? So then at the very least, we can sort of have a better understanding of one's experience. Very often, especially with men, we tend to at times want to test the waters and see how people are going to respond. So we make those statements hoping that someone will actually follow up with us, right? To kind of be like, oh, okay, so I said this, they're okay, they didn't react, they didn't respond. So verbal statements can definitely be a sign. Maybe the person is making a lot of changes in their lives. They may be selling most of their stuff or all of their stuff, or giving away things that are very important to them, right? Or maybe writing particular letters, or some drastic changes, maybe substance use, maybe becoming very religious by comparison to what they were before. So any significant changes, it's important to check in. It doesn't mean that they're planning on to end their lives, but it's something that could potentially lead to that, or could be a sign of it. So checking in and be like, what's going on? I'm noticing this behavior. Is everything okay? Right. So start like Diego, what do you think?
I mean, I'm going down the list that I had here I've made previous to preparing for the presentation. And I mean, I was going to separate it actually, but you kind of mentioned them all. There's a verbal aspect of the suicidality, and there's the physical responses to the stressors. And some of the things that Dr. Thano was mentioning is talking about wanting to die, wanting to kill yourself. Other things of they're talking about feeling hopeless and just having no purpose in life, about feeling trapped, and just unbearable pain, something that you just can't deal with anymore, and just feeling like you're burning to other people in your life, how you just become this overpound weight for others in your life. And then the other side of that token is the actual physical reactions and the use of alcohol or drugs, the acting anxious or agitated or reckless. You know, if we notice somebody that you love, somebody close to you, somebody that you have encountered for some time, and you begin to see these different behaviors and reactions to different things that they didn't in the past have, please be aware. Have a conversation with those people. Sleeping too much or too little. You know, the depression is a first sign. This type of depressive symptoms are the first sign of what's leading to being withdrawn, isolating yourself, showing rage, talking about seeking revenge to others because of X, Y, or Z for no specific reason, and displaying extreme mood swings. That's also a sign of leading to this type of behavior and feelings and that. So I think, you know, Dr. Thano was right on the spot of this type of behaviors that need to be recognized and aware, you being aware of what's going on around you and the people around you as well. And even with yourself. If you start to feel, sometimes we get so caught up in the bubble and we don't even see what we're doing. And when we go in, I talk to my clients a lot about reevaluating yourself and having, you know, checking yourself at the front door. Like, okay, hold on, I'm starting to you know, follow these patterns that a couple of weeks ago, a couple of months ago, I wasn't doing. Like, what is happening with me? And having a conversation, it's a homework that I assign my patients on that is, you know, talk to yourself. Have a conversation with yourself. Get in front of that mirror and talk to yourself and say, hey, what is going on right now? What is happening? How are you feeling? How am I doing? When you're feeling exhausted, you know, recognizing that. Those very important points in life where you usually disregard, have a moment. Stop and question yourself. Am I okay? Is this a time where I should seek for help, talk to someone, talk to my partner, my parents, my siblings, my best friend? And I think it's important for all of us to take that breather, take that step back. And I do an exercise, which is very silly, but I do this with every single client that encounters anxiety or depression. I said, I want you to grab a piece of paper and I want you to write a word. So they do. And I said, I want you to grab that paper and I want you to put it right next to your nose. They're like, okay, I can't see what it says. I said, okay, pull it away. And they're able to see it. I said, what's the difference? And they tell me, well, it's too close to my face. It's too close to me, so I can't see it. So exactly. That's how we feel. That's what it means about feelings. We're so caught up in the situation that we're not able to see the big picture. But the minute that you take a step back and look at the big picture, you're like, oh, so this is what's going on. And that's the time to reflect. And a lot of patients have encountered the reality of their current life when they do something so small. And they're like, oh my God, I didn't even look at that way. I didn't look at my behaviors. I didn't look at my true feelings of how I'm actually feeling right now. Because it becomes so overwhelming that we don't get a chance to take a step back and take a look at how we're feeling, how we're doing.
Right.
And it just goes from A to Z compared to taking that day to day, step one step at a time.
Yeah. Yeah. That's so interesting that you're talking about looking from a more macro level at the larger picture of things. So maybe you guys can talk to me a little bit about what that pressure to provide and just from society, from family, friends, the financial piece of it, and how that can play a factor in pushing someone more towards, acting upon those feelings and thoughts of harming themselves.
Yeah, that's a great question. I actually was going to add a little bit more exactly to what you just asked, Jessica. So I appreciate the question. I think, when it comes to men and suicide and situations are also another factor that can lead someone to harm themselves or attempt to end their lives, right? Being fired or being expelled from school, right? As men in our society and different cultures, we are very often viewed or expected to provide financially, right? So imagine being fired and you're the only breadwinner, as we call it, right, in the family, right? You have or it's not just your immediate family, but maybe your family of origin is depending on you financially, and if your identity is anchored very often in your finances, and that's taken away from you, I can imagine how that could also potentially lead someone that identified as male to feel like they're not worth anything, right? So having people in your lives that may have lost their job is important to check in with them and see how they're doing, right? To recognize that there may have been a very significant impact in their lives. Even losing a partner, losing a child. Again, as men, if we are supposed to be the protectors, the providers, right, the caretakers in so many different ways, and you lose a spouse or you lose a partner or you lose a child, that can also feel very can lead someone to feel worthless and feel like they're not capable of doing that. So when that happens, how do we check in with our male identified people in our lives, right? Keeping that in mind as well, being mindful of what that can look like for them, right? I think Diego mentioned that serious mental illnesses can definitely be something that's important for us to check in. Even anticipation of loss of financial security, especially now during COVID,
right?
It's been huge, right? Having had a solid job, but because of COVID now no longer, and not being many jobs available for some of us, right? And if your identity is anchored into that financial. If you're the provider financially and it's taken away, I can see how that can lead someone to maybe have those thoughts, experiencing those thoughts, depression, anxiety, right? Feeling overwhelmed by the responsibility that one has to provide for their significant other, for the family, for the children, or whoever they're responsible for, right? So keeping an eye for that as well is important.
Awesome. Yeah.
I think Dr. Thano touched the most important part right now, and is the changes in life. We are all encountering that all over the world, not just here in America, but all over the world. If I'm not mistaken, I was reading an article a little bit ago, and the suicide rate has increased tremendously in the last year and a half, 2 years, because of the change of statuses that every single person has encountered. Other than the fact that people have gotten extremely sick, it's devastating to see what is happening at this time. But this is the time where I think, and I truly believe from the bottom of my heart, is that we should be more united. I think it's important as men because, like Dr. Thano said, we are the anchor of the boat. We're the ones that hold it together.
Yeah.
And we take that responsibility upon ourselves. We were brought up with that responsibility. We've given that responsibility from birth. But like I've always said, it takes a village to raise a child. It takes a village to make you happy. And you can't do things on your own. That goes from your family to your friends to seeking for assistance in any way, shape, or form. One of the things that I work with my patients the most is requesting them to do a physical evaluation. Wow, you would be surprised how many people have told me, I've never been to the doctor. And I see clients that are 35, 40 years old. I only go when I have blood dripping down my body. And it's crazy, but that's where it all begins. So we're expecting for you to get you better, for you to start seeking the services that you need, the help that you need, the assistance, the support. But yet we don't know what's going on with you medically. And it all begins with our bodies. If our bodies aren't okay, our minds aren't going to be okay. And if our minds aren't okay, our bodies are going to be okay. So it all connects. And I think it's important for us to begin to take care of ourselves, not just mentally, but physically as well. The exercising aspect, our eating habits. I mean, they all have to do so much. And I think it's important for us to just start with that and begin with that to be able to move on forward. And one of the signs that as we were discussing earlier is the amount of care that we take care of ourselves mentally and physically. When you have someone in your life who's always taking care of themselves, and they begin to push that aside, that's a sign.
Yeah.
You become careless and you become disconnected with your mind and your body. And constantly you disconnect with the people around you. And this changes, they go, I mean, things change on a daily basis. And it's just, I think it's important how we manage those changes. How can we help the community to connect themselves with the right people to find that support? And I think that's what we're here to do today. We're here to educate and to tell you before somebody else sees it, see it for yourself. Allow yourself to evaluate you. And if you see a lot of changes happening, seek for help. It's not going to make you weaker. It's only going to make you stronger. And your family cannot be okay if you're not okay. I'm getting chills as I said that. And it's so true. And just because you are seeking for help, that doesn't make you weaker. You are the role model for your children and for your partners to be able to seek for services later down the line in their lives. You know. So I guess this is just an invitation to everybody out there, every single man that thinks that they're alone. They're not. You're not the first or the last. As Dr. Thano said, he got into this field to be able to realize a lot of things about himself. Well, I think every single one of us has, you know, and it's a beautiful thing. It's a wonderful thing, but it does take work. I'm not going to lie. It doesn't happen. It doesn't change overnight. It takes some real hard work, but it's definitely worth it. Once you find that you begin to find that stability, strong ground, it's definitely a positive step.
I'm wondering if maybe we can touch on the piece of drugs and alcohol and kind of how they play a factor into someone who is having these thoughts and feelings about suicide, and maybe even specifically for that group of individuals that are predisposed to depression, and maybe kind of what that looks like.
Substance use has continuously deteriorated society as a whole. And it plays such a big part of your mental health and stability. Drugs and alcohol have always been the box in which you kind of jump in when things become stressful. And it's for both men and women. But since we're focusing on men now, we have a high intolerance. And it's unfortunate. I wish it was the other way around, because I feel sometimes the women are stronger. But having said that, we tend to find a way of disconnecting from reality and hiding elsewhere. And this has been our go-to.
Yeah.
The substance use. Unfortunately, this plays such a big role, leading to the mental instability, the emotional instability. And if I'm not mistaken, another article that I was reading, it was talking about most people that have fulfilled the suicidality has been through substance, some type of substance, or had been under the influence and have history of that. There are a lot of treatment centers. There's a lot of AA meetings, NA meetings that we all could definitely seek for. And even if you're not an addict, just having yourself exposed to one of those meetings will definitely change your life in one way or another. From the stories that you hear to the experiences that people have had, and just getting yourself out there to learning, because learning could only enrich you, can make you stronger, can make you better. So just because you don't have a substance use, but you every now and then use, and that's your go-to, experience it. Give yourself a chance to get out there and talk to people that have had 15, 20 years of sobriety, or even a year of sobriety. They have so much to teach you. It's unbelievable what you could learn about yourself and that other person throughout that process. So it's really important. I think it's super important for us to recognize that if a family member is encountering this, and maybe they're drinking more than usual, maybe they're a little more disconnected and acting a little different, maybe that's a sign. And be aware of that. Recognize that. Talk to each other. Be present for one another in this process.
Yeah, that's great. It's great to hear, Diego. Yeah, I completely agree with what you shared. I was thinking and reflecting on substance use, and I think culturally and our society, we've sort of normalized for female identifying individuals to sort of express emotions and be open about their emotions, right? It's okay. Versus for us that identify as men, it's not okay. It's not okay to express emotion. It's not seen as strong. It's seen as weak. That we shouldn't let things bother us. We shouldn't let things get to us, which then lead us to then wonder, what do we do when we have emotions? Right. We, in so many ways, we're sort of like it's like a trap set up for us, where the only emotion that it's sort of acceptable, it's anger. But then we also get in trouble when we get angry.
Right.
And so then we are very limited in terms of our avenues of expressing emotions, processing emotions, experiencing emotions. And very often we turn to substance use to deal with our emotions, right? Because we don't know what to do with them, and they are painful at times.
Yeah.
They are uncomfortable at times. So then we haven't taught how to cope with it. We haven't provided the space. We haven't been provided the space or given permission to express them, work through them, speak about them. So then substance use becomes our band-aid to deal with them. Very often when something happens in our lives, my friends would be like, let's go grab a drink. Wait, I just told you that this happened in my life. But let's go grab a drink.
Right.
So that message is what? We can't talk about emotions. It's not okay to talk about emotions. I'm uncomfortable with your emotions. And the only way to deal with it is by drinking. So then, depending on what's happening in your life, substance use becomes the cure for you. But because it's a band-aid, it's a temporary, you have to continue keeping it up, which then can lead to depression, can lead to anxiety, depending on the substance that you are using. But also the other way around too is that if you use substance use is something that you often engage in, can lead to, right? Or if you are feeling depressed, you can use substance as a way to manage your depression and not seek mental health, right? So it can go either way, right? And that's why it becomes really important, not just for us as psychologists, because we can make an impact, but as a society, as a culture, we need to shift this idea that it's not okay to talk about your emotions, that again, it's a form of weakness, that you're not man enough if you are not able to. Very often my clients will tell me that, like, I don't seek support from anybody else because they're going to think that I'm weak, that I'm supposed to be the one that they come to. I shouldn't be the one that go to them, right? So you have very few options to deal with what's happening for you, and substance use is one of them, unfortunately.
Yeah, absolutely. It's interesting that you mentioned the uncomfortability piece about it. And just thinking about recently, at least in my area, I've seen commercials for, it's like an online therapy, BetterHelp, and just, all these different avenues that have come up since the pandemic. And it's so interesting because they talk about the things that are not helpful and the statements that people make. You have everything to live for. Your family would be so disappointed in you. And those are very second nature, type of responses that people want to give. And so for those that are viewing, maybe you can give them some talking points or some different options to use when they are brought this information from, someone in their life who identifies as male, other things that they can say, because that can be an uncomfortable conversation if this is not the world that you've chosen to immerse yourself in. So what are some different things that they can, use if they are presented with this information?
Yeah, that's a great question. I appreciate you bringing that up. I think our the world around us, whether it's social media, whether it's movies and shows, they do a really bad job at supporting us. And unfortunately, if that's the only teacher that we have, it's disappointing. It's disappointing. But some of the things that I would consider or maybe suggest, especially when you are suspecting someone that may have suicide thoughts or anything like that, would be, just ask the question directly. I mentioned this earlier, just ask the question directly. I think there is a myth among a lot of us that if we were to ask the question directly, that we would for some reason plant that into someone's head. Trust me, there's no research that shows that. There's no proof that shows that we be planning. Someone wants to end their life, it's not because you're planting them, because they already been thinking about it. And just because you're saying it, it's not gonna make anyone want to end their life, right? So please ask the question directly. If the person is reluctant, be persistent. This is a very heavy topic, a difficult topic. It's not easy. Again, we spoke about men and mental health, right? We're not supposed to talk about our feelings. So if you ask once and the person says, you know what, I don't want to talk about it, and you say, okay, sounds good, most likely we're going to feel like, you know what, yeah, that's where I thought that they can handle it. So be persistent. Don't give up, right? Of course, don't be too pushy. I don't want you to irritate someone, but don't give up on them. Try another time, right? Talk to the person alone in a private setting. Tell them, you know what, let's go out for a coffee. Or let's go out for a walk, right? Where you can provide a safe space for them to potentially, be open to opening up. And then allow them to talk freely. Just listen. Ask them what they need, right? If you're with them, what do you need? What do you need from me right now? Especially as men, we are fixers. We want to fix things. So if another man comes to us and wants to talk to us about what's happening, we're like, okay, you can do this, and you're like, wait, that's not what I asked, right? So let him talk freely. Give yourself plenty of time. Don't rush through it, right? Don't rush through it, because then it's gonna feel like, well, this person is already tired, doesn't want to listen to me, And if you ever are in that place where someone is coming to you and wants to speak with you about difficulties or things that are happening in their lives, have some resources available.
Yeah.
Just be like, hey, I know this place, they're great, or I know this number, give them a call, or there's this app, give it a try. And just give it to them. Don't push them, just give it to them, let them work through it, let them give it a try. Because very often what happens is when we are feeling down and we have a place where it's safe, we may reach out at that moment, like, you know what, someone gave me this card, let me give it a try.
Yeah.
So there's a couple of things that I would suggest.
Awesome. Yeah.
I completely agree. I think the most important thing I think here is being present, making yourself available for that person.
Right.
If as men, we tend to derive from our feelings very much and kind of, I'm okay. There's nothing, I'll be fine. Or you know what, I'm just stressed or just work. And you try to put Band-Aids all over the place just to kind of hide the soreness to a certain extent, the pain that we're encountering. But if you are allowing yourself, as I'm going to talk from a patient perspective, if you're allowing yourself to speak to someone, give yourself an opportunity to discuss what it is that is affecting you, what it is that it's taking you to the point of seeking that help. And as a listener, just be there, be present.
Yeah.
Allow them to speak, no judgment. We're no one to judge. And it's really easy as humans to be in our go-to. You know, like, you're doing this and you're doing that, or every now and then we're going to do this. And I tell my patients it's physically hard to actually do this.
Yeah.
Because sometimes we got to look at ourselves before we judge, put judgment onto others. And I think being present is the most important thing that Dr. Thano mentioned, other than the other things that he mentioned, but just allowing yourself to be present and hearing the other person out, to speak their minds and speak their feelings and speak their experiences. It's key to be able to helping that person take that next extra step or that next step to feeling free, to seeking, to receiving that help. And I think that's something that we can all get better at, even as in our own field. And it's meeting the person where they're at, not the client, not the patient, but just meeting the person where they're at. It could be women for your partner, men for your partner, children for your parents, and allowing that person just to be present. It goes a long way. And I think it's the channel of communication that we could all improve on and we could all work on. Because it could definitely help us reach success, reach stability, and have that emotion connection. And sometimes we lack in developing that and just working yourself through it. Like I said, as a listener, just allowing yourself to be there and be present for your friend or your husband or your son or whatever it is. But I think it's important to give yourself an opportunity to do so.
Awesome. Yeah. Well, I definitely want to thank, both you, Dr. Thano and Diego, both of you guys for being here and being fully present during this discussion. For those of you that are watching us, thoughts of self-harm and depression can be a very overwhelming feeling, but you are definitely not alone in this process and in this journey. Please feel free reaching out to a mental health professional at Casa de la Familia. We're here to provide the support and help that you deserve. If you are having suicidal thoughts and you cannot wait, to be scheduled with someone at Casa, please feel free to contact the National Suicide Prevention Hotline number. It's shown here at the screen. For those that are viewing impaired, that number is 1-800-273-TALK 8255. Again, that's 1-800-273-8255. Dr. Thano, also you mentioned earlier in the discussion about your private practice. So if you would like to extend that as well.
Yes. So as I mentioned earlier, I do have a private practice in Orange County. The name of my private practice is Core Psychological Services, currently providing virtual appointments, which is very convenient for many of us. I think, Jessica, you mentioned you'll provide my website at some point and maybe
Absolutely.
contact information. So feel free to reach out to me and I'll do my best to support you in whatever ways I can. And thank you for having us and having me here. Really, it's been a joy to talk about this topic, and I appreciate you bringing this up for us.
Yes, absolutely. And you mentioned kind of in your first responses, some of these topics can take, hours and more than one, session. And so for the month of September, Suicide Awareness and Prevention Month, Casa de la Familia is actually offering more resources and discussions all month. So please feel free to tune in with us on all of our social media platforms. Thank you all again for, viewing this video. We hope to see you next time. And that'll be it for today.
Thank you.
Thank you so much, Dr. Thano. Thank you, Jessica, for giving us the opportunity to discuss this very difficult subject. And it's been a pleasure being part of this. So thank you.
Appreciate you both.